Lupus LA would like to thank our generous sponsors for their support of the Your Story, Our Fight podcast. Gemini Beauty believes in beauty for a cause, and in their case, the cause is lupus. The team at Gemini is changing the skincare game for good. We thank GSK for their focus on autoimmune disease and their continued support of Lupus LA. Hello and welcome to another episode of the Lupus LA podcast, Your Story, Our Fight. I'm your host, Adam Selkowitz, and as always, I want to thank Gemini Beauty and GSK for their incredible sponsorship of this podcast. Today, I am talking to Tiffany Kaloustian. She is a naturopathic practitioner and an integrative and functional health practitioner. And we're going to get into what all of that means as we go through the podcast. But I am thrilled to have you with us, Tiffany, and happy to share your lupus story today.
Thank you so much for having me. It's such an honor.
Excellent. So tell me a little bit about your life before lupus. You know, where were you in life? What was your plan? Because I know where you've ended up is really completely different from where you were starting, and that lupus really changed your life, not just physically, but also in where your career is headed. So tell me a little bit about, you know, where you grew up and what you were doing before you had a lupus diagnosis.
Yes, absolutely. So I was born and raised on Oahu in Hawaii. Had, you know, just the ocean as my front yard.
Sounds incredible.
Thanks. Yes. And people always ask me, why did you move to California? But, you know, I grew up, you know, a normal childhood. You know, everybody has things that they go through, right? You know, certain childhood traumas like the divorce that my parents went through, the passing of two dear loved ones before I was 16 years old. So, you know, but you don't really realize that those types of things could possibly impact you later in your life. And it wasn't until, you know, I left for college and I began to notice that, you know, my joints were achy and I'm like 17 years old and I'm wondering, this is new. And, you know, I was told when I would go see a doctor, like, oh, you know, you're stressed, you know, being in college, this is just typical stress. You're completely healthy. And I was dismissed as my symptoms will go away. My symptoms did not go away. In fact, they got progressively worse to the point where they had to refer me to a rheumatologist who ran a bunch of panels on me. And there were a few red flags. She didn't really specifically tell me what they were. And I didn't really ask. I was a teenager. Mm-hmm. I was like, oh, if the doctor doesn't think anything is wrong, then I'm fine.
And where were you? You just was in college when you were, okay. Mm-hmm. And where did you go to college? In California or?
Yes, I was in California, Northern California.
Okay.
Yeah.
Got it.
So I was out of my home state. So already that was stressful on my nervous system, away from a small hometown of all my family and friends and thrown into a university. I didn't know anybody. It was a shock to my system, and climate change, X, Y, and Z. Mm-hmm. So then fast forward a little bit, when I started seeing a rheumatologist, they decided to do a couple biopsies on my hands. They ruled out rheumatoid arthritis. And I'm like, oh, I couldn't even have that anyway. I'm 17. But I didn't understand that rheumatoid arthritis was an autoimmune disease. However, I didn't even know what an autoimmune disease was, right? Mm-hmm. Because I kept getting, oh, you're fine. You're fine. You're fine. You know, manage your stress better. That was my advice. Mm-hmm. Okay, so I'm out of college. I was a young mom, and just had my firstborn, and it hit me like a ton of bricks. I couldn't get out of bed. I was nursing him, and I was so fatigued that it was hard for me to get up to go to work because I was also working at the same time. Well, I took some time off, and it wasn't until he was about 2 that I started to go back to my doctor and say, I still don't feel right. In fact, I feel worse. Took a couple of years for them to run all the tests that they needed to on me in order to finally diagnose me. And keep in mind, by the time I was diagnosed, my son was almost 4 years old.
Wow.
So this journey of being in chronic pain started when I was 17, and it took years for people to listen to me, and also to get I guess my markers, they said, finally met the lupus criteria. And I was diagnosed with lupus SLE.
Got it. And so have any of the doctors thought that the pregnancy probably exacerbated or triggered? Because we know a lot of women in particular are diagnosed at that age, or right post childbirth.
Yes.
I'm surprised the doctors didn't sort of pick up on that aspect. Even it's what's surprising, I think, in your story is that they were looking for autoimmune. It's not in a lot of stories we've told nobody's even getting any autoimmune tests. So what's interesting to me about your story is that they were on the right track, but they didn't go far enough.
Mm-hmm. Yes, and according to the rheumatologist that diagnosed me, my body reached the tipping point where finally my ANA was positive, my DNA was strong positive, and I'm talking like not moderate positive, it was off the charts positive. Whereas just a few years prior, it was, not
iffy,
really enough.
Right.
Equivocal. It was equivocal. So they couldn't diagnose me with positive or negative. I think it was in the equivocal range, which a lot of my labs were equivocal. But then I was told to go home and just rest, and I'm fine, because I think they probably honestly thought it was stress. To give them credit, I was young, I was fit, I don't think that they even thought that because they asked me about my history. I didn't have any known lupus in my family history.
Right. Well, and I think one of the pitfalls or one of the things that doctors sometimes say is, oh, you have a young baby, and they attribute that you're tired, you're fatigued because you're a young mom. And, I think that's a little challenging also. And then, so you were diagnosed, did they immediately sort of figure out the treatment that worked for you, or how was your initial diagnosis? And also, I guess even before we get to that, did that diagnosis give you some relief in the sense that you've been searching for the answers to what has been bothering you? Did that fact that you got that diagnosis help you at all?
It's a great question. It did, but it also frightened me. So to finally have a diagnosis helped me, because I was just searching for answers. And this was before I discovered functional medicine. Because later, as we talk, functional medicine actually found me before I became the practitioner. But the way it was presented to me was, it was such a startling moment for me that I just shut down. Because how it was revealed to me that I had systemic lupus was that it was an advanced stage. Advanced. He said, you have lupus SLE. I didn't even know what an autoimmune disease was. I said, did I catch lupus from somebody? I had no clue, right? Because I had never done any research on autoimmunity ever. And the way he mentioned, I have lupus SLE. There are several of my organs that are not functioning properly. He would like to start me on methotrexate as a form of chemo to calm my immune system. I have to go in for methotrexate treatments. And then I was put on Imuran. And remember, I rotated off of several medications over the years, but just off the top of my head, I was put on Imuran. I was also told to be on prednisone. I rotated off and on with hydrochloroquine and Plaquenil. So, this is somebody who never takes medication. I don't even take Tylenol for headaches. So to have all of these pharmaceutical drugs that, bless his heart, he was truly looking out for me to survive. Because apparently, I didn't follow up or whatever, to where the autoimmune disease progressed so quickly. And like you said, you made a really good point, is after childbirth, that could have, kind of like exacerbated the symptoms. You
take these medicines that the doctor prescribes. Does it help you? Does it give you pretty bad side effects? What were sort of the, I'm building up to sort of where we lead to the shift in your treatment and the shift in your belief system. But I want to sort of talk about what happened to you when you took the medicine.
Yes. So I followed the doctor's orders faithfully. I went through my treatment of chemo, which brought my immune system, it kind of brought it back down to where I wasn't close to organ failure. I then was told to stay on a rotation of those medications I just mentioned, right? And for a while, I felt great because it was doing its job. It was truly suppressing my immune system, right?
Right.
And it was kind of like giving my body a break from so much pressure, from so much of the war that was happening inside of my body. But I hit about an 8-month mark where my lupus markers were still there, but it wasn't progressing. So the doctor was happy. He says, you're not progressing. The medications are working to keep your lupus here. As long as it doesn't go back here, we're happy. But staying here at the midpoint was actually getting really hard on my body. My frame, I've always been a small frame, and I was already my healthy weight, honestly, was 105. I'm little. I'm 5'4", maybe on a good day, 5'5". But, I just come from like a, genealogy of just lean, parents but that was healthy for me, I dropped to 85 pounds within 6 months. The doctor weighed me and he says, oh, so we uncovered that we couldn't really pinpoint necessarily which medication it was, but the culmination of the few that I was on was triggering a lot of weight loss. It killed my appetite. I had no desire to eat, and when I did eat, it would cause such pain to eat. And I know that sounds crazy, but it's like I sometimes chose, okay, let me just make another smoothie because it feels better for my body.
Right.
That's not really healthy, right?
Right.
Becoming a fruitarian was not something that I initially said, oh, I just want to just eat fruit. No, that was what my body could process and digest to get something into my body. It was hard. I lost the weight. My hair was thinning so much that you see I have long hair. I've had long hair my whole life. But because my hair was like falling out, I chopped it super short when I was really sick. At my lowest weight, I cut my hair because I was so embarrassed. But that just made my weight loss look even greater because then you could see my neck, you could see my and so I was misjudged a lot. But aside from that, it brought on a lot of anxiety, restlessness, sleeplessness, depression. And the worst part is I went to get my retinal images done. Now, keep in mind, this was only at this point, I got my retinal images done a year after I was on one of the medications.
Plaquenil, yeah.
Plaquenil. And that was it's like less than 2% that you would have a change in your retinal imaging. I had that change, and it was so slight. My eye doctor, my ophthalmologist said, because I told her my medication, she says, I would like for you to take this report to your rheumatologist. I did. And what he told me is I was beginning to develop all the rare and often deemed, it won't happen to you side effects.
Right. The dangerous side effects of, It
was slowly beginning to happen.
So you had to stop Plaquenil.
I stopped Plaquenil. Yes.
Right.
But, all the other medications I mentioned, they cause so many other problems. And I just didn't feel well. I couldn't even be a vibrant mom to my little boy. And I was so young. And I couldn't figure out why this was happening. So what I did is the doctor had said, I'm going to change you to another medication. I said, doctor, with all respect, I just need a break. I think my body just needs a break. I just feel like my body is just breaking down. He says, well, you've made a lot of progress. I said, yes, and I'm very grateful. I have made progress enough for my labs to be quote unquote stable, but I don't feel well. I feel like I honestly, Adam, I felt like I was dying. My blood pressure was always scary low. I had no energy. I wasn't eating. I could feel beats in my heart. I mean, it was to the point where I was beginning to talk to my husband about, if I don't make it, and to have that talk and to have my husband stare at me like, you mean it's this bad? Because I was truly scared, Adam, for that I wouldn't be around to see my son grow up.
So I think this is a good time to take a quick break and then come back. And I want to hear what led you to all of these practices and how that changed your life. So take a second. We're going to regroup and we'll be back after these messages.
Please visit our online store at lupusla.org. By purchasing Lupus LA products, you are directly supporting lupus patients and their families. For more information, visit lupusla.org.
We are back on the Your Story, Our Fight podcast, talking to Tiffany Kaloustian. So Tiffany, you sort of hit this low point. You hit this point where you had to have this pretty awful conversation with your husband. And then what changed? What was the thing who introduced you to functional medicine? What's that journey like?
Yes. So what that looked like, I left my doctor's office feeling really defeated, but also empowered. Meaning, okay, I would like to take control of my health. I respect and admire and honor my rheumatologist for stopping the progression. But I felt, okay, there was so much more I haven't tapped into. So I started to research and find out answers. I initially, started to read books, and I would listen to podcasts, and I was like, wow, functional integrative medicine, taking how your body functions and how we integrate different things into our lifestyle, right? So it could be diet, it could be all the lifestyle choices. It could be the air that we breathe, the water that we drink, the toxins that are around us. And I'm thinking, wow, nobody ever talked to me about my diet. Nobody ever talked to me about possibility that I had antibodies to gluten, to the zonulin, to the gliadin and gluten. Like, what was that? I just started asking a ton of questions. I became like a kid who just asked why all the time, right?
Mm-hmm.
And so I guess
I have a couple of those.
Right. So, and that led me down this path of just trying to find more answers. Why was my body overreacting? Why was I having an overstimulated immune system? Why is my dsDNA and my ANA positive? Meaning, why are there antibodies to the double-strand DNA in my cells? Why are there antibodies to the anti-nuclear core of my cells? Right? What's going on? What caused that?
Mm-hmm.
So I initially started as a health coach. I got my degree at IIN, the Institute for Integrative Nutrition. That course just rocked my mind. It just blew me away. All the things that I learned. That was getting my feet wet in functional medicine.
Right. Okay.
So then I pursued naturopathic practitioner credentials and also my integrative and functional health credential. And during that time, I found a functional health practitioner who now works for the company that I also am a provider with, who runs functional medicine tests on anybody who's my client. Those tests began to reveal such amazing data for me. And I was mindful. I was mindful of watching my markers to make sure that the lupus wasn't getting out of control, right? But I was off of my meds. And I never tell any of my patients or clients to get off of your meds and do what I did. I don't. I tell them my story. I tell them what my journey was like. I also, told them how mindful I was to keep track of my markers. But I also told them that I felt my body shift so quickly once I started to implement the functional medicine modalities. And it started.
So tell me the difference. I want to make sure our audience understands. Tell me the difference between naturopathy, functional medicine, integrative medicine. Give me kind of the quick, one sentence definition of what each one of those is.
So a naturopathic approach is really focusing on what nature has provided for us, right? Like since the beginning of time, it really focuses a lot on herbs, herbal treatments, right? Versus, like for example, like treating something with an antibiotic versus something herbal, right? So
Got it.
I studied a lot of herbs. I studied a lot of holistic things in terms of like very much related to like acupuncture type of techniques, even though I'm not an acupuncturist. They do use a lot of herbs. And so I was able to calm a lot of my symptoms down, by using certain herbs implementing them into my protocol. But the functional and integrative, I really feel was what gave me the answers, because when I started doing systemic lab work in my body, I was able to see the antibodies to certain things like food and to gluten or to certain chemicals that I unknowingly was exposing myself to. Now, remember, autoimmunity, everybody understands what epigenetics is, so that even if you have a predisposition to develop an autoimmune disease, there usually are certain factors that kind of, push you more into that direction. Oftentimes, what's overlooked is stress, trauma that's unresolved, toxins, of course, we talk about, a compromised gut microbiome, or different triggers that we are, exposed to, like infections that are never resolved, or infections that turn into co-infections, right? Or something, it could be a viral infection or something tick-borne, like a Lyme. So it causes us to become a detective in our bodies, to really, unfortunately, it is an investment, because functional medicine is not covered by insurance. And so it's going to take, planning and budget to really dive deep into your body to figure out what's hidden, what could be the root cause of the systemic inflammation.
And so you find this path, you start taking this path, and, I appreciate what you said about, people not necessarily stopping their regular medicine or talking to their doctor about all this. Cause, at Lupus LA, we're very clear that we're telling these stories because it's your truth and it's your personal, it's your personal story. And I have done some of this stuff. And, I think everybody kind of has to pick off their own menu. So I think that's really great advice, and I appreciate that. Tell me kind of now where you are, what it has done for you, and how you're feeling, and what the status is.
So, during the whole process of being a patient, right, functional medicine before I became the practitioner, I'm answering your question, but kind of like giving a little bit more detail.
Yeah.
In my 20s, when I was really sick, I lost the ability to ovulate. So I no longer was able to have another child. So I was told in my 20s, I'm infertile, and it's part of lupus, because the lupus antibodies are attacking my reproductive system, and I was okay with that, because I have my beautiful boy, and my life at that time felt complete. But to not ovulate so young, that tells you that there's some dis-ease going on in your body. Through the functional medicine, through the protocols that I was on, and healing, over time, I just saw a drastic decrease in my inflammation, increase in my energy. My hair grew back. I felt like myself again. I felt like I had my life back. And all of this was monitored through my rheumatologist. But then when I became certified, I was able to monitor on my own. So I feel, so honored and blessed that I can run my own lab work, because I know what to look for. And even the greatest blessing was after being told I couldn't get pregnant again, I got pregnant. Very much surprised. And as you can tell, I just bawled and dropped to the floor when I saw that pregnancy test. And my newest son, Samuel, he's just a constant reminder to me that healing is possible. And that, if we just keep advocating for ourselves, we keep searching for answers, we don't give up hope, we don't stop loving our body. I have to say that so strongly, because there were points where at my lowest points, I really hated myself for being in this situation. And I realized I can't heal hating myself. I embraced self-love. I embraced my dance with lupus. And that's where my practice name came from, because that is my story. I've embraced my dance with lupus. And just 2 years ago, I ran my labs again. My lab work shows two things. One, I no longer have the criteria markers for lupus SLE. But number two, I still do have markers for an undifferentiated connective tissue disease, meaning that my dsDNA is equivocally positive, right? It's kind of like on that borderline.
Right.
And my ANA titer is moderately positive. And my centromere is moderately positive. All of those relate to each other. So that tells me this is, and I'm okay. This dance with autoimmunity is going to be lifetime. And I've embraced it because I've seen the side where it was dark. And I also am living the life where I found the light and I found, the life back, in my body and the vibrancy that I used to have. And yes, I'm older than I was, much older than I was when I was diagnosed as a teenager. But I feel like there's been a lapse of time where I've lost some time and I'm like, I'm going back to relive all those years I felt like, was taken away from me. I have to be energetic. I have a 3-year-old and there's no way that I'm not slowing down anytime soon. I'll tell you that.
Well, you're amazing. I think what you said about the dance with lupus is something everybody should really take to heart, because I do think it's a constant. I always looked at it as putting out fires, right? You're the fireman and you're always kind of looking, and when one pops up, you got to put it out. But I think the dance metaphor is really special because I think it's really positive, and I think it tells your story so perfectly. And we're going to put up where people can find you and where they can find your practice. And, I'm so appreciative of the story you've told us, and really happy for you that you found that joy and gotten into a lighter place. And I hope that continues. So thank you so much for being a guest on this podcast and for all you bring to lupus patients.
I appreciate you, Adam. I wish I found you when I was first diagnosed. I didn't have that support group. What you do is incredible for families and for those who are dancing with lupus. So thank you for having me, Adam.
On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.